Hello viewers, I'm Dr. Kavita M. Triplam College of Nursing. In this video, I'm going to talk about wound healing. Before moving into the explanation of wound healing, let us discuss the objectives that the viewers will be able to at the end of this video. Understands the meaning of wound, lists the various types of wounds, explains the process of wound healing, discuss the types of wound healing, describes the stages of wound healing, recognizes the factors affecting wound healing, and identifies the complications of wound healing. Introduction. A skin wound results from the breakdown of the epidermal layer integrity. Wound healing mostly means healing of the skin, which begins immediately after an injury to the epidermal layer and might take years. Wound healing is a dynamic process which includes highly organized cellular, humoral, and molecular mechanisms. Wound healing has three overlapping phases, which are inflammation, proliferation, and remodeling. Any disruption in these overlapping phases will lead into abnormal wound healing, and complications will arrive at the end of the wound healing. Looking into the definition of wound healing, wound is a break in the integrity of the skin or tissues, often which may be associated with disruption of the structure and function. Wound healing is a natural physiological reaction to tissue injury. However, wound healing is not a simple phenomenon, but involves a complex interplay between numerous cell types, cytokines, mediators, and the vascular system. Let us discuss the types of wounds. Wounds can be classified under various types. The first classification is based on the separation into open or closed wounds. Closed wounds are the wounds which the surface of the skin is intact, but the underlying tissues may be damaged. Examples of closed wound are contusions, hematomas, or stage 1 pressure ulcers. Whereas open wound, in open wound, the skin is split or cracked, and the underlying tissues are exposed to the outside environment. The next classification of wound is based on the type of wound, which includes clean incised wound, lacerated wound, bruising and contusion, hematoma, puncture wound, abrasion, crush injury, injuries to bone and joint, injuries to nerve, injuries to arteries and veins, and penetrating wound. The next classification is based on thickness of wound, superficial wound, partial thickness wound, full thickness wound, deep wounds, complicated wounds, and penetrating wounds. Next, we'll see the process of wound healing. The process of healing involves two distinct processes, which includes regeneration and repair. So what is this regeneration? Regeneration is when healing takes place by proliferation of parenchymal cells and usually results in complete restoration of original tissues. The goal of all surgical procedures should be regeneration, which returns the tissues to their normal microstructure and functions. Whereas repair is a healing outcome in which tissues do not return to their normal architecture and function, and typically results in the formation of the scar tissue. Next, we'll see the types of wound healing. Broadly, we can divide the types of wound healing into primary healing and secondary healing. Primary healing means uncomplicated healing of a non-infected, well-approximated wound. Example, surgical wound. The primary healing will have the following characteristics: clean and uninfected, surgically incised, without much loss of cells and tissue. Edges of wound are approximated by surgical sutures, wounds with opposed edges, and primary union. The secondary healing are the healing by secondary intention. If the wound healing occurs when the wound is disrupted, the secondary healing stage begins. During secondary healing, granulation tissue formation and epithelialization over this new tissue takes place. Secondary healing will differ from primary healing in several aspects, which includes inflammatory reaction is more intense, much larger amounts of granulation tissue are formed, wound contraction occurs in large surface wound, substantial scar formation and thinning of the epidermis occurs. If the wound healing course in secondary healing is disrupted by infection, dehiscence, and hypoxia or immune dysfunction, these types of wounds are more susceptible to infections and poor healing. Next, we'll move on to the discussion of stages of wound healing. Optimal wound healing should involve 4 continuous and overlapping phases. When the skin is injured, our body sets into motion an automatic series of events, often referred to as the cascade of healing, in order to repair the injured tissues. The stages of wound healing proceed in an organized way. The cascade of healing is divided into these 4 overlapping phases, which are hemostasis, inflammation, proliferation, and remodeling. Although the stages of wound healing are linear, wounds can progress backward or forward depending on internal and external patient condition. Next, we'll discuss the first phase of wound healing known as the hemostasis. The process of wound healing being closed by clotting, which happens very quickly, starts when blood leaks out of the body, the platelets aggregate and adhere to the endothelium surface within seconds of the rupture of blood vessels epithelial wall. After that, the first fibrin mesh begins to adhere in about 60 seconds. As the fibrin mesh begins, the blood is transformed from liquid to gel. The formation of a thrombus or clot keeps the platelets and blood cells trapped into the wound area. The thrombus is generally important in the stages of wound healing, but becomes a problem if it detaches from the vessel wall and goes through the circulatory system, which may possibly cause a stroke, pulmonary embolism, or heart attack. The second stage of wound healing is known as the inflammatory phase, which begins right after the injury when the injured blood vessels leak transudate, causing localized swelling. Inflammation both controls bleeding and prevents infection. The fluid engorgement allows healing and repair cells to move to the site of wound. During the inflammatory phase, damaged cells, pathogens, or bacteria are removed from the wound area. The white blood cells, growth factors, nutrients, and enzymes create the swelling, heat, pain, and redness commonly seen during this stage of wound healing. Inflammation is a natural part of the wound healing process and is only problematic if prolonged or excessive. The third phase is known as the proliferative phase, where the wound contracts as new tissues are built. Here, there are 3 distinct stages: filling the wound, contraction of the wound margins, and covering the wound, known as the epithelialization. Next, we will see the sequence of events in the proliferative phase. Here, the wound contracts and new tissues are built up with collagen and extracellular matrix. The wound contracts as new tissue are built up. A new network of blood vessels must be constructed so that the granulation tissue can be healthy and receive sufficient oxygen and nutrients. Myofibroblast cause the wound to contract by gripping the wound edges and pulling them together using a mechanism similar to that of a smooth muscle cells. In a healthy stage of wound healing, granulation tissue is pink or red and uneven in texture. Healthy granulation tissue does not bleed easily. Dark granulation tissue can be a sign of infection, ischemia, or poor perfusion. Finally, epithelial cells resurface the injury. Epithelialization happens faster when wounds are kept moist and hydrated. Generally, when occlusive or semi-occlusive dressings will remain correct tissue humidity and optimize epithelialization. The next phase is known as the maturation phase. Maturation phase or remodeling phase. Here, the collagen is remodeled from type 3 to type 1 and the wound is fully closes. The cells that had been used to repair the wound but which are no longer needed are removed by apoptosis or programmed cell death. The collagen laid down during the proliferative phase. It is disorganized and the wound is thick. Collagen is remodeled into a more organized structure along lines of stress, thereby increasing the tensile strength of the healing tissues. Fibroblasts secrete matrix metalloproteinases, the enzyme which facilitates remodeling. Usually, remodeling begins at 21 days after an injury and can continue for a year or more. Even with the cross-linking, healed wound areas continue to be weaker than uninjured skin, generally only having 80% of the tensile strength of unwounded skin. Next, we'll see the factors which affects the wound healing. Generally, factors affecting wound healing can be categorized into local factors and the general factors. The local factors which affects the wound healing are infection, presence of necrotic tissue and foreign body, poor blood supply, venous or lymph stasis, tissue tension, hematoma, large defect or poor apposition, recurrent trauma, X-ray or irradiated area, site of wound and underlying diseases. General factors which affect the wound healing are age. Younger the age, the faster the wound healing. Obesity, smoking also affects the wound healing. If the person is malnourished, then wound healing will be delayed because we need a source of nutrients for the better wound healing like zinc, copper, vitamins like C and A. Anemia, malignancy, jaundice, diabetes, HIV and immunocompressive diseases, and intake of steroids and cytotoxic drugs also affects the wound healing. After looking into the factors, let us see some of the complications which arise out of wound healing. The complications are deficient scar formation, which includes wound dehiscence and ulceration, or excessive formation of the repair components like aberrations of growth, excessive amount of granulation tissue formation, or exuberant proliferation of fibroblasts and other connective tissue elements, which are known as desmoids or aggressive fibromatosis. Or there will be a formation of the contractures after the wound healing if there is no range of motion provided the joints proximal and distal to the wound area. So to conclude, healing process is remarkable and complex, and it is also susceptible to interruption due to local and systemic factors. When the right healing environment is established, the body works in wondrous way to heal and replace devitalized tissue. Understanding of wound healing is as important as knowing the pathogenesis of disease. The ultimate satisfactory wound healing is goal of treatment. If we are able to understand the mechanisms of periapical wound healing, we can design treatment approaches that best maximize favorable conditions for wound healing to occur. This is all about the wound healing. So here are some of the references which is made to prepare the content. Thank you.